Hi, I'm Allie, a level 2 MOMAC McMaster nursing student, and I'm here to put an indwelling catheter in you. If you just don't mind me asking your name and your date of birth for patient identification. Hi, Mr. Mancini. So I'm here today on doctor's orders to place a indwelling catheter in you because you've said you've had some abdominal pain and some troubles voiding and some discomfort. So the bladder scan came out to 630 milliliters, and so that's the reason we're putting a indwelling catheter in you. Hi, Mr. Mancini. So I'm going to be performing your indwelling catheter today. And so to start off, I'm just going to be washing my hands with some hand sanitizer and getting the catheterization kit open and ready. So, I'm going to pull up the covers first. So Mr. Mancini is in the supine position with just his legs open slightly. So you got to be careful here to so that everything stays sterile. So I'm just, with my clean hands, I'm going to grab the outside 1-inch corner of my sheet. And now I'm going to be grabbing the 1-inch corner of the drape to ensure that everything stays sterile. So with shiny side down, I'm going to be tucking this under with just the 1 inch under my patient's bum to ensure that no urine is spilt on the covers. Now that that drape's on, we're going to grab the 1-inch corner of the other drape with the hole in it and put the shiny side down, which is waterproof. And now we're going to be opening up the catheter. And this is dirty, so if we just lay it out on the sterile field. And that can just be discarded. As well with that. And just drop the catheter out on a sterile field. And the bed is at my hip's height, so there's no back damage. So now I'm going to put on my sterile gloves. And grabbing the inside of the glove so that everything stays sterile. And with my sterile hand, I'm going to be grabbing the glove and putting my other hand in here. And this can be discarded of. So I'm going to be using a size 12 French catheter because my patient is not prone to any blood clots, and the smallest size will also give him the least amount of risk for infection. So to start off, I'm going to be using the iodine and pour it over the cotton balls to clean my patient's peri area. And so for this procedure, I will not be actually using the iodine, but I will pretend to pour it over the cotton balls. So now with my sterile hand, I'm going to be grabbing the tweezers and using 1 cotton ball with iodine covered solution and using my non-sterile hand to touch the patient. And I'm going to do 1 swipe around and throw this in the garbage. And then using another cotton ball, I'm going to do it again to ensure that everything is clean. And the last one. and that's garbage. So now I will be with my sterile hand touching the catheter and inflating the balloon to ensure its integrity. So I will be removing the cap of the normal saline and using this with my non-sterile hand. And with my sterile hand, I will be touching the catheter and inflating the balloon to ensure that there's no holes. So you can see here that there's no holes, so the catheter can be used for the patient. So I'm going to take out the normal saline again. And the balloon has been deflated. I'm going to put this off my sterile sheet because it's no longer clean, and my catheter will stay on my sterile. So the next step is to use my lubricant to ensure that there's easy insertion. And so I will, for the sake of this procedure, I will pretend to pour out the lubricant on my tray and grab my catheter and insert it into the lubricant, about 7 centimeters with lubricant on it. So now for insertion, I will be grabbing it as well, about 7 centimeters, and touching the patient and inserting it and yeah. So I will insert the catheter until I see some urine coming out. So now I'm going to inflate the balloon, and I no longer have a sterile field, and inflating the balloon ensures that the catheter will not come out, and it stays put inside the bladder. So now my balloon is inflated, and this goes in the garbage, and I will pull on my catheter to ensure there's some resistance where the balloon is. And so I can feel some resistance. So now both my gloves are non-sterile, so I can touch this catheter bag, and I'm going to attach it to the catheter. And it'll just slide in there, and you can ensure that the catheter's in the right place if urine comes out into the catheter bag. And so now I will be attaching this catheter to the patient's leg and putting the catheter bag just below the bladder level, attached to the guardrail. Okay, so now we are just cleaning up the area, and everything can just be discarded of into the garbage. And then Mr. Mancini's sheets can be pulled down for integrity. Okay, so now that the procedure is done, I'm able to take off my gloves, and I will be washing my hands using soap to get rid of any bodily fluids that might have touched my skin, instead of using hand sanitizer, as it will not do a very good job. Mr. Mancini, due to doctor's orders and that you've had the catheter in for about 36 hours, we will now be discontinuing it. So this is a clean procedure, so I will just be wearing clean gloves. Maybe some sanitizer. Okay, so now with my clean gloves, I will be removing the drape and exposing the catheter. And so I have my catheter bag here. So now we're going to be deflating the balloon before we pull out the catheter. And I'll just be attaching it to here and pulling back to take in all of the normal saline until I see air. And once the balloon has been deflated, I can discard of that. I will be removing the catheter bag, and I will be getting a basin here for any extra urine that falls out. and pinching the end of the catheter and pulling out the other end. So now the catheter bag can be discarded in the biohazardous waste, and any extra urine can fall into the basin. So now I will be touching the patient and pulling out the catheter. This will be discarded in the biohazardous bin, and I will be washing my hands with soap and water just in case any bodily fluids got on me. Hand sanitizer will not do the job correctly. So now I will be re-draping the patient. And Mr. Mancini, the procedure is now done for the inserting out a catheter and taking out a catheter. So you now will be able to void on your own, and if you have any discomfort or pain, please let one of us nurses know.